See, this is a very different video. I am going to speak about HbA1c is a myth. HbA1c is a myth. HbA1c is a myth. Okay, myth. Okay. So when come to diabetes, many people think that they think this HbA1c is a very gold standard. No. It has been told, even in American Association of Endocrinologists have told, it is not, it's a myth. It's a myth. Even that is my personal opinion also. It's a myth. I'll explain you correctly, okay? I'll explain you so correctly. See, hemoglobin, this is hemoglobin, bounds to glucose, is called HbA1c. This other is called glycated hemoglobin. Please go through it. Hemoglobin bound to glucose is called HbA1c. Other is called glycated hemoglobin. I think you understood. Please write it down. You will understand better. Hemoglobin bound to glucose is called HbA1c. That is called glycated hemoglobin. Got it? Got it? Okay, got it. Did you understand? Did you understand? Okay. Now I will explain one more word. Anemia means low level of hemoglobin. ANAEMIA. ANAEMIA. Anemia. Anemia means low hemoglobin. LOW. Anemia means low hemoglobin. You understood? Anemia means low hemoglobin. Okay. So now you understood the meaning about anemia. Okay. So there are so many causes of anemia. For if you take the Indian population, so many people are anemic. They have low hemoglobin level. For example, for basic example, if a person is having a worm infestation, WORM, a chronic worm infestation, he will be anemic. Right? Number 2, for example, a female is having overbleeding during her menses, during her menstruation cycle for long period, she will be anemic. Her hemoglobin will be low. Right? For example, in liver diseases, hemoglobin will be very low. In kidney diseases, hemoglobin will be low. In bone diseases, hemoglobin will be low. Ordinary chronic parasitic infections, hemoglobin can be low. That is anemia. In some bacterial infections, chronic infections. So there are thousands of reasons for low hemoglobin. Anemia means low hemoglobin. So this is a myth. That is I am telling you. See, hemoglobin binds with glucose to form HbA1c. Right? So you need hemoglobin for this attachment. Right? Hemoglobin has to be attached with glucose for HbA1c. See, now if your hemoglobin is very low, consider your hemoglobin is very low. That is anemia. That is anemia due to any reason. Now the hemoglobin is low. Consider, okay. How will this bondage happen? Hemoglobin is low due to so many reasons I told you. This hemoglobin, there is no hemoglobin. How this binding will happen? Right? Got it? Right. So hemoglobin, in conditions like where hemoglobin is low, how will the HbA1c be so high? If your hemoglobin is low, how will your HbA1c be so high even if you are a diabetic? If your hemoglobin is very low, how will your HbA1c be very high even if you are a diabetic? See, because there is no bondage. This hemoglobin bound to glucose. Hemoglobin bound to glucose is HbA1c. So it is a myth, I told you no. As long as any blood test is depend upon the hemoglobin, it cannot be a reliable test. It cannot be a reliable test. Understood? Say, okay, let me give an example. A patient is having high blood sugar. He is having high blood sugar. He is diabetic. His hemoglobin is low. So his HbA1c will also be low. We will think that he is not a diabetic. So in anemia, the HbA1c will be very low. But the patient may be a chronic diabetic. Because this binding cannot happen, that's all. Hemoglobin bound to glucose forms HbA1c. I'll repeat. Hemoglobin bound to glucose forms HbA1c. If hemoglobin is low because of anemia or whatever reason, this bonding cannot happen. So you may be having high blood sugar. You will have high blood sugar. Sometimes at the same time your hemoglobin will be very low because of anemia. So HbA1c alone is not a gold standard test for diabetics. As long as most of us have low hemoglobin. Due to various reasons I told you. You hear this video once more or 2 times, you will understand that HbA1c is a myth. You have to hear this video 1 or 2 times so that you will understand better. Okay.